Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you're listening today. On today's episode, we're going to be talking all about mental health in regards to your cycles and fertility. We'll be discussing the implications of dealing with long-standing chronic medical conditions like PMS, menstrual migraines, PCOS, and irregular cycles, but also the mental toll that dealing with infertility can play not only on an individual, but on a couple. Now, I do want to give a bit of a disclaimer that I am not specifically a mental health specialist. However, as part of my extensive family medicine training, we do have expertise in the diagnosis and treatment of mental health conditions. If you are suffering from any mental health condition, please know that there is help available, and I would encourage you to contact your local healthcare professional to get the specialized care that you need. So let's start off today with a discussion about a patient of mine whom we'll call Catherine. Now, Catherine and her husband came to see me because they were struggling with infertility over the course of the past 6 years. She was already charting her cycles, and we had done her initial lab evaluation. When she came back into the office for her follow-up visit, I asked to review her charts as we always do. And when I looked at her charts, I identified an interesting pattern where she and her husband were only having intercourse around their fertile time. I asked if this was typical for them or if there was something else going on. She got very quiet, and then she started to cry and said, "This infertility journey has really driven a wedge between me and my husband. Both of us want to do everything we can to have a baby, but it has led to so much stress in our relationship that we've actually been growing further apart. We still make sure that we come together during the fertile times, but we basically avoid each other than." Catherine and her husband had never really stopped to take inventory of the extreme stress that they were placing on themselves because of trying to work together towards this common goal. Now, one of the things that I talk a lot about with my patients that are dealing with infertility is the importance of allowing yourself to take a break. So rather than prescribing a bunch of treatments and continuing to just push forward with medical interventions for Catherine and her husband, my treatment recommendation for them that day was to go home, set aside your charts, and stop focusing on becoming pregnant for at least one cycle, maybe more if that's what you need. The other important piece from a medical standpoint is that untreated mental health concerns causes significant stress on the body. Increased physical or emotional stress will increase your cortisol levels, which in turn will throw off the rest of your hormone levels, making it more challenging to become pregnant. So, Catherine and her husband left that day visibly disappointed because they really wanted to keep pushing forward with treatment. However, we made a plan that they were going to follow up with me in about 2 months so we could reassess and go from there. When they returned to see me a couple months later, they looked and sounded so different. They told me, "Nobody has ever told us that we can take a break. We just felt like we needed to keep pushing forward and realized that we were setting ourselves back." They used the time of taking a pause from trying to achieve pregnancy to pursue couples counseling and focus on each other once again. The importance of allowing yourself to take a pause from the intensity of charting and blood work, trying to figure everything out, and constantly focusing on trying to get pregnant when you're dealing with infertility can be incredibly overwhelming. My goal anytime we discuss a course of treatment is not to make certain that you can get pregnant, but my goal always is to help improve your overall health and well-being. Not only physically, but also mentally and emotionally. And if this allows your body to be in a better place to be able to get pregnant, then it's a win for everybody. So let's talk a little bit more about mental and emotional health when it comes to dealing with chronic conditions. There are many studies in the medical literature when it comes to chronic diseases. When we talk about people who are living with conditions like high blood pressure or diabetes, heart disease, or chronic arthritis. And what we know is that these individuals are more prone to depression and anxiety. Imagine if you're spending not only a significant amount of money, but also time, energy, resources on trying to better control your disease to help improve your quality and quantity of life. And now add on the fact that there are things in your life that you just can't do because of those medical conditions. It can become very frustrating to try and navigate those changes. For many people, it can be isolating, even if they have people who are supportive of them. This association with chronic disease and mental health concerns also applies to women who are dealing with chronic conditions, such as PMS, postpartum depression, or polycystic ovary syndrome, or those who are debilitated by menstrual migraines, severe periods, or recurrent miscarriages. The constant need to plan their lives around their menstrual cycles happening or not happening is a whole way of life that can become incredibly frustrating. So when I work with women to correct those menstrual cycle irregularities, we certainly focus on what we can do from a standpoint of charting your cycles, evaluating with appropriate lab work, and getting a specific diagnosis and treatment plan in place. However, I do spend time discussing lots of other factors in regards to lifestyle challenges, whether that's improving sleep quality, healthy eating habits, regular exercise, and how to get to a point of better overall health and wellness. I also spend time discussing how your menstrual conditions impact your daily life in regards to your mental health and needing to alter daily activities, as this can give some incredible insight as to how well someone is coping with their chronic condition. If you are looking to do a personal assessment to determine if your menstrual symptoms are deeper than just the physical impact, I would invite you to step back and take a bird's eye view of your life. Ask yourself if there are things in your life that you are altering or changing because of your menstrual cycles or fertility concerns. For example, are there hobbies that you normally would enjoy that you're now avoiding? Is it difficult to want to be around friends or family members? Is it challenging to get out of bed in the morning or go to work or care for your other children? Are you eating enough food or are you overeating? Are you unable to sleep or find yourself sleeping too much? If you deal with anxiety, are you having panic attacks, heart palpitations, or find yourself so caught up in your thoughts that you're distracted from your daily work or activities? For people that are depressed or sad, do you find yourself crying without being provoked or being unable to function from day to day because your emotions are so overwhelming? This list certainly isn't exhaustive, but as you can see, the range of symptoms that can occur is vast, and it makes it challenging sometimes to pin down what particularly the underlying cause is. Now, when it comes to treatment for mental health concerns in regards to cycle wellness, I prefer a multifaceted approach. I always recommend that women and sometimes couples are working with a licensed mental health care professional like a counselor or a therapist, because this becomes critical not just to achieving wellness, but also to maintaining that mental health awareness and giving you the tools you need to manage whatever comes next. We know what has happened historically in our lives in regards to our emotional health, but if we don't ever learn what we can do to help improve that going forward, it makes it really difficult to know how to manage a new situation when it arises. Another thing that some people find beneficial is a support group of others who are going through a similar path as you are. Just being in a group where people have your similar struggles and can really better understand and be a safe space for you can provide a new level of community that can help prevent feeling isolated. The other thing, as was the case with Catherine and her husband, is being able to step back and take in everything that's going on in regards to your health without feeling like you need to have all the answers and get everything solved right this second. The importance not only of healing yourself from an emotional standpoint, but also being able to decrease your stress hormones in order to help restore your body's physical hormone levels can make such a huge difference. Just as a side note, I have at least 3 couples that I have worked with over the past 10 years that became pregnant when I had them take that pause. They weren't charting their cycles, they weren't taking any of their medications for fertility, but that's when they were able to get pregnant, when they quit putting so much stress on themselves to try and achieve. One of the other things I evaluate as far as treatment goes can include recommendations for certain supplements or vitamins. Now, there have been a lot of studies that show being deficient in particular vitamins can increase depression or anxiety, And sometimes helping to evaluate and restore those natural vitamin and supplement levels can make a huge difference. For people that are dealing with more debilitating mental health concerns that are impacting their daily life, there are definitely instances where I discuss how to safely go on prescription medications. There are times that medications can be appropriate to help impact the neurotransmitters in your brain to improve your quality of life and help you to function. I think a lot of people get scared about going on medications because they can have some side effects. But I think this is where it's important to have an honest discussion about the risks and benefits of going on medications versus just not treating your condition and continuing to suffer and struggle. The other thing that I always talk with people about is that just because you start on a medication doesn't mean that you have to stay on it forever. So many people know of individuals that have been on medications for a really long time and feel as though that's not the thing they want to do. However, there are certainly ways to treat you with medications while you are continuing to work on the other changes in your life. Whether that's giving you time to go through counseling and learn new skills, or developing new habits with your sleep, diet, or exercise, all of those things can make an impact long term. But while you are working on and learning those things, the importance of prescription strength medications can really help to improve your daily functioning. Ultimately, it is so important to work with a physician who is able to evaluate not only your menstrual cycle concerns when it comes to changing your course from a physical standpoint, but also making sure that you have somebody who is able to help navigate the emotional challenges and stress that can come from living with and dealing with these things on a long-term basis. Now, if you are ready to continue to work on holistic wellness, I would love the opportunity to work together with you to address your chronic menstrual cycle concerns or help you navigate your fertility journey in a way that pays attention to your emotional well-being. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, where you can schedule a free discovery call with me to learn more about our package-based pricing for healthcare. We customize your treatment plan and include options to access a hormone coach, fertility awareness charting experts, a registered dietitian, a fertility acupuncture specialist, a health coach, and of course, all the medical care you need from me as a board-certified physician. We are currently able to see people for in-person appointments in the Cedar Rapids area or can arrange for a telehealth visit if you live in the state of Iowa. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.